On Tuesdays and Thursdays here on Fox 6 News at 4, we speak live with a doctor from UW Health, usually about the latest on the pandemic and our status here in Wisconsin. We will get to that in a moment, but first, I want to bring in now Dr. Jeff Potoff, UW Health Chief Quality Officer, to talk a little bit about the ice. I know it may sound silly, but there are some real health concerns that you're seeing a sharp increase in because of what a lot of us are dealing with weather-wise today.
Absolutely. We are seeing more patients in our emergency departments today with fall-related injuries. Folks who tried to brace themselves for the fall end up falling on their wrist and breaking their wrist. People who hit their heads in car accidents. Particularly challenging for those who are elderly, who have osteoporosis. They're more likely to have fractures. And for those that hit their head, those who are on blood thinners for medical conditions like atrial fibrillation or a blood clot, there's a pretty good risk of having bleeding on the brain, which is a serious condition that you'd want to get checked out if you're one of those people.
Things you always have to remember, of course. And, I know when it comes to icy conditions, we haven't really had our fair share of snow at all this season, and now we're dealing with ice. But those are two very different things when you're talking about walking and driving on them.
Absolutely. They both increase emergency department visits, but for different reasons. These ice-related injuries, broken bones, head injuries, snow, we see more heart attacks and sometimes fingers that the snowblower gets. So they both increase our work, but for different reasons.
All right, well, let's talk about COVID-19 now for the last minute or so here. We had a story the other night about the first child death here in Wisconsin due to multi-inflammatory syndrome. We've reported how rare this is, but can you speak to this for a moment and why and how this happens to some children who contract COVID?
Yeah, no, we do see this predominantly in children, those under the age of 21 for sure. And it happens after an infection with COVID-19. Now, it may be an infection that you knew about, or maybe you didn't, and it can develop anywhere from, immediately afterwards to about 8 weeks afterwards. And the hallmark symptoms are persistent fever, fever over 100.5 degrees for multiple days in a row, then followed often by rash, redness in the eyes, or conjunctivitis. And this is an inflammatory condition that can infect or affect your organ systems. So heart, lungs, kidneys. And it can be a rough ride for those families and patients who have it. So if you had COVID or you have a child who had fever for multiple days in a row, good idea to talk to your medical care provider, see if this might be something that they could be struggling with.
Is it kind of just a crazed immune response that happens?
Essentially, yeah, the immune system kind of gets really worked up and causes this inflammation of other body systems. It's somewhat similar to a disease we've known about for a long time called Kawasaki's disease. So if you've heard of that, this is somewhat similar, but it can make kids really sick, especially if it attacks the heart. It can send kids into heart failure, and that can be a scary thing.
Now, we don't know whether or not this child was vaccinated, the one who passed away due to this multi-inflammatory syndrome. But that does lead us to this next question about vaccines in kids. Are you still finding a lot of hesitancy among parents getting their children vaccinated, or is that lessening a bit?
I think we still see it a little bit in that 5 to 12 range or so. Those younger kids, we're not seeing as good an uptick. We do see a bit better uptick in those older kids, high school students and things like that. I think there's just this misconception that COVID-19 doesn't cause a problem in these young kids. Why would I get my kid vaccinated? And at a population level, that's true. But any individual kid could get very sick. They could have long COVID, or in the example we just talked about, they could come down with multi-system inflammatory syndrome secondary to COVID. So good idea to get those kids vaccinated, even if it doesn't seem as urgent as, say, adults or older people.
And last thing quickly, there's a lot of schools that are now allowing masks to be optional, a big change for a lot of the big school districts around here, my kids' schools included. What are your feelings on that? Are we to that point yet?
I think we're getting really close. Whether it's now, whether it's the first week of March, the second week of March, that's probably about the right time. The only hesitancy I have is that issue we just talked about. If we do have classes with a high rate of unvaccinated kids, that could cause some transmission in those classrooms. But with cases decreasing the way they are, it is time to start talking about whether or not we need these masks.
Dr. Jeff Potoff covered a lot of ground today. We appreciate it. Thank you.
Thank you.